Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Because we are the most famous physical therapists on the internet.
In our opinion, of course.
Today, Brad, we're going to talk about how and when to perform self-massage for sciatica. And we're talking about herniated disc versus piriformis syndrome. And you need to kind of know which one you have, because it's going to change what we do.
Two different treatment protocols.
Right. So, by the way, if you are new to our channel, I'm going to get this done right now, Brad.
Right to the point.
If you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to Facebook and like us because we give away stuff.
Yeah.
And also, we like to be liked. All right, Brad, you did a video in the past where you're talking about sciatica, and you were describing what it is. So it's pain, numbness, tingling.
Typically down the leg.
Right, typically one leg, right?
Right, past the knee, go down into the foot, even into the toes.
And you can get weakness from that.
Oh, sure.
You can get drop foot from it. And if it's down both legs, it may be something else.
Right.
It could be still sciatica,
sure,
but less likely to be. And you had come up with statistics on this, Brad, that you found out that normally from sciatica, 3 million cases a year are from a herniated disc.
Sure.
So that's the disc that's in your back, between the bones here, and it's bulging out or herniated out, and it's hitting one of the nerve roots. I just want to show this real quickly, Lonnie.
Yeah.
Am I in a good spot? So I don't know if you can see that red right there. It's pushing against the nerve root. This nerve root actually extends way down to the leg. So.
Yeah, if you irritate the nerve up here, you're going to get symptoms wherever.
Right.
Go ahead.
Yeah, so if you're going to do massage for that, there's one type of massage we do. But if you have a different type of problem here, which is called piriformis syndrome, which is also known as fake sciatica.
Ah.
So now the piriformis muscle is a little triangle-shaped muscle. I don't know if we indicated that well here, but it comes from the sacrum and a little bit in the notch here, and it attaches right to from this bone all the way down to the greater trochanter, which is on the hip.
Right.
Now the sciatic nerve comes down right underneath it, or it could actually pierce through it even, Brad.
Sure.
But it comes down through that. And if you spend a lot of time sitting, or what I found on some of these, Brad, is they actually tore the muscle, and then as it healed, it tightened up over the sciatic nerve. So this muscle can squeeze over onto the nerve, kind of pinch on it, and cause pain down the leg.
All right, so the symptoms are very similar. It's just whether it's up here or just a few inches below, that's where the impingement or the lesion is.
Right, but it's critical to know which one is which.
Sure.
Because this treatment is way different than this treatment.
Right.
So we're going to show you 3 quick tests. So one of the tests, Brad, is very simple. Is actually, let's get rid of some of our mess here.
Yeah, what's going on here?
Oh my God.
Oh my gosh, we just broke our spine. We'll get another one.
Call the doctor. So one thing you're going to do is you're just going to try to find that spot. So here's if you go the point of the hip, and here's the sacrum. So the muscle's right in here.
Right.
If you're tender in here, you push on here and compare one side to the other.
Right.
That's one sign indicating that it might be the piriformis muscle.
You move this knee up and down, Bob. If you don't know, you can do that. You'll feel there's a bony area, and that's that greater trochanter, and you can feel it.
Right.
And then the sacrum is there, and that's how I determine. I go from there to there, and right in there is where we...
Yep, and if you rub across there, and again, you should see a difference from side to side.
Yes.
So,
right, so you compare one side will be very tender, the other side's like, oh, no big deal.
Now the other one you can do is you can just go ahead and you're going to go ahead and stretch the muscle and see what happens. So I put my ankle a little bit beyond my knee here, and then I'm going to pull this up like this.
So
and that's going to
right knee towards left shoulder, across the body.
And this is the one where I've almost universally see this in Brad with the ones that have piriformis syndrome. They do this one, and then they do this one
on the other leg,
and they can really see a difference.
Right.
I mean, it's just it's very noticeable right away.
You bet.
So, and what was the third test I wanted to do? I was going to do I was going to do, this is more to see if it is more from the sciatic nerve itself, from the herniated disc. If it's a herniated disc from your back, a lot of times if you bend forward like this, or if you even extend back, any movement of the back tends to make it worse.
Right.
So And you know, of course, there's the straight leg raise one too.
Sure.
Of course, I don't know. That might be positive with Piriformis, huh?
Yeah, that could be too. What about the one laying prone where you do the internal rotation of the femur?
Yeah, that's a possibility too. Actually, Brad, I think the better one is actually doing this. Is bringing it down like this, and you bring it up like this, and now you're tightening up the muscle of the piriformis.
Yep.
And so you bring your leg over, you put this to your knee, and you bring it up like this, and that tightens up that muscle.
Okay.
And that causes you know, stress over the piriformis.
Sure. So that if it had piriformis, one leg would be obviously tighter than the other. Using that.
And one leg would bring on the pain.
Sure.
So. All right, let's start talking about massage, Brad.
Yes, do it.
All right, let's first talk, again, if it is piriformis muscle, you definitely want to do some massage to it because it's going to definitely help. So what I like to do is I like to you're going to do this yourself, so you got to get yourself in a good position. And I like to put the muscle a little bit relaxed. And it's an external rotator, Brad, so I like to put 2 pillows between the legs.
Okay.
And you kind of lock up the ankles together like
Sure.
that. And now this muscle is a little bit relaxed. You know, now
Yep.
there's not tension on it. And you can start off with just your hand if you want. Again, you're going to find the spot. You'll know because it's going to hurt.
Right.
So, and you can rub across it like this.
Right.
And you can also do circular motions.
And you're going to get in deep. Bob's just going on the surface. But
Yeah,
if it's
you're
for real-
really going to want to, I mean, you could use your knuckles.
Yep.
You could, you know, the knuckles of your
'Cause
thumb.
you got to get through some muscle and some soft tissue before you get to that piriformis, and it just needs some pressure.
And that's often why we recommend you might want to try some of these things. Do you want to grab one of the tools here, Brad?
Well, which one should we start with,
I don't
Bob?
know. We got like torture tools here, don't we?
Well, Bob, I hate to use that word, torture. That's all for the health of it.
Either one of these is fine. There's the Theracane
Yep.
or the back knobber.
They're just shaped differently, but
Yeah.
do very, you know.
And
do
this
the
one
same
comes
work.
apart, easier a little maybe to take on a trip, I suppose.
Sure.
But this one, you can really get in there and you can really start doing some, not damage, some,
Get some work done.
some
and
therapeutic.
the idea when that piriformis is tight, that muscle becomes contracted and basically knotted up. And if you can get pressure on it for a period of time, usually 30 seconds or so, that'll allow that muscle to release. And once that releases, you get circulation, you get the pressure off the nerve. Life is much better.
Exactly. It may take a few sessions, but, or should I say precisely?
Precisely, yes. We're trying to get away from the, exactly.
You know, never did I dream when I grew up that I'd be massaging my butt in front of people. So,
Right, this is weird, Bob, so
I know.
get used to it.
All right, next one.
What about the tennis ball? I kind of like that.
Oh yeah, there's the tennis ball. You can kind of lay on that, right?
Right.
But I was going to show this while I'm in
Oh,
this
yeah,
position.
yeah, while
I'll
you're-
let you show the tennis ball.
Yes, I'll do it.
So this is the Pure Wave. You know, we've mentioned this many times. Just one more instance where I think this really pays for itself.
Sure.
Because this is a hard area to massage. Now I'm not even pushing that hard,
Mm-hmm.
and it's getting in there, and it's again got the percussion.
Right.
So it's ooh.
Wow. It's really sending Bob for a loop.
It's funny, but yeah, it's doing a good job,
Yeah,
Brad.
see, they're entertaining as well.
Yeah. All right, so why don't you show the tennis ball?
This is a family show, Bob. Okay, here we go, the tennis ball. This is the way I usually like the tennis ball. You can use a lacrosse ball. It's a little firmer, you know, a little
They're
more
a lot
aggressive.
firmer.
So here I am. I'm going to find that bone right there in the sacrum, and oh yeah. And even a healthy piriformis is a little more tender than that. So
It's a tender spot.
yeah, so I'm going to get right on it right there. But boy, I tell you, I'm putting a fair amount of weight to this arm and my legs, and I'm gently working down on it. And then you roll. I don't know if they can see that ball under there. And you'll find it. And then you work it forward and backwards, right to left, circles, whatever seems to work good. And again, you're going to do this for 30 seconds to a minute or so, depending on how you respond.
The only precaution I have here with this, Brad, is you know, if the nerve is fired up a little bit and you go right over that nerve with the ball, it could make things worse. I mean, I don't want you making the pain worse.
And if the symptoms down your leg are getting worse while you're doing this or as a result, it's too aggressive.
I always found the ball, it's a little harder to direct to the spot.
Yeah.
You know what I mean? Where these you can go around the spot first.
Sure.
And then if there's a tender spot that sends the pain down, you can avoid it.
Yeah, because when you're doing that, you got to be pretty mobile and have some upper arm strength and control to get what you want.
Exactly. not to rain on your parade, Brad.
Yeah, I don't want to get rained on my.
All right, next, you know, if you're going to do massage for a herniated disc, first off, quite often, I think Brad and I would agree, you don't need to do it. I mean, a lot of times we you know, recommend doing the extensions instead.
Right, directional stretching.
Yeah, directional stretching. But if you are, we've had people that are so tender when they come in that we have started them on massage. Like I've had people start by getting up in somewhat, maybe even almost a elevated position like this.
Sure.
And then, you know, or a couple pillows pulling them up.
Right.
And then having someone massage them themselves.
So then we're working the muscles not over the piriformis, although you could, it may be tight there as well, but we're working the muscles around the vertebra there, because they can tighten up as well from the pain, and they just naturally will tighten.
So again, what we recommend it more often is this extension program, which we've outlined in many of our other videos.
Sure.
But if you are going to try some massage yourself, I'm going to show you know this is about massage, Brad.
Sure.
So you could try some standing massage for your sciatica. And what you could do is, you could take your knuckles and you could rub right up the muscles like this on both sides.
That's what your knuckles are for.
Yeah, I didn't know that.
Well, Bob. Yep, so like there you can, here's my knuckles, the other hand is going to help for us. And you also, the nice thing about this, you're getting some extension.
You're getting some extension. That's what I was going to say, Brad. You can actually even work into extension a little bit.
Yep.
Again, don't make the pain worse, but if it actually feels okay and maybe even feels a little bit better, this is a great one to do. And then of course you can use the back knobber. I like this one for this, not for sciatica, but just for my back. When it gets tight, I just rub it along there. Oh,
another home run. How about?
Yeah, another home run.
It's you can see the difference between the two. There isn't much. You have different handles. Yeah, so all these are options. It doesn't mean that they're all going to work equally. You go through and find which one really does the job and stick with it.
And I know you can do this one too. You can go back and do extension while it's doing the work for you. Going along the pelvis there. So you know, again, if to sum up here, Brad, real quickly, if you have the piriformis syndrome, you definitely want to do the massage. If you're having sciatica from a herniated disc, not as needed normally, but you certainly can try it, and it certainly won't hurt.
Right, as long as it doesn't hurt, you do it.
Thanks for watching.
Wow, you got
yeah.